This week, unpaid care rose significantly at Minnesota hospitals, and Sutter Health pledges $2 billion in Minnesota investments as it joins with Allina Health. Welcome to the March 20th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson. Lawmakers got a fresh look at financial pressures on the health system this week, with hearings in St. Paul and Washington focusing on hospital costs and compensation. It included a report to the Minnesota House Tax Committee from the Minnesota Department of Health. State health economist Stefan Gildermeister presented MDH's biennial report on uncompensated care in Minnesota. Research found unpaid care, including charity care and unpaid bills, rose by nearly a third from 2023 to 2024, approaching $440 million annually. He said that may grow even more with changes to Medicaid looming next year.
The bottom line is, it is going to be a greater struggle for more hospitals in the state.
The report also said that two safety net hospitals, HCMC in Minneapolis and Regions Hospital in St. Paul, accounted for nearly a third of unpaid care in the state in 2024. Gildermeister said rural hospitals also struggle with unpaid care. In Washington, the House Committee on Energy and Commerce's Health Subcommittee held a hearing on lowering healthcare costs in the U.S. this week. Ellen Florek has more.
American Hospital Association President Rick Pollock told members of Congress during the hearing that hospitals themselves are struggling with fast rising prices.
In 2025, hospital spending on medical supplies, equipment, and technology increased 10%, and that includes life-saving devices clinicians rely on every day, not to mention significant investments in cybersecurity. Hospital drug expenses rose more than 13% in 2025, driven by rising prices and the introduction of new high-cost therapies. About 60% of a hospital's expenses go to paying their talented workforce, and those costs are increasing 5.6% a year.
Pollock told Congress that overall hospital costs increased 7.5% in 2025, nearly 3 times faster than inflation in general across the U.S. He also testified that hospitals last year spent nearly $43 billion handling prior authorizations for care and appealing claim denials by health insurers.
That's Ellen Florek. Back in Minnesota, there was more hospital news on the front pages this week. Allina announced it would join with California-based Sutter Health. The combined system would operate 39 hospitals and 400 care sites across California, Minnesota, and Wisconsin. The combined system would serve about 5 million patients a year. Sutter said it would invest $2 billion in Minnesota and Wisconsin if the deal wins regulatory approval, and plans to add ambulatory and specialty care sites in Minnesota and recruit more physicians. Allina will retain its name, president, and board of directors after the deal closes. Also this week, Governor Tim Walz and Revenue Commissioner Paul Marquardt proposed a supplemental budget for the rest of the biennium, fresh off a new budget forecast last month. Abby Machtig has more.
Walz pitched a new child care tax credit that he said would help bring down the cost of living for middle-income Minnesota families. He also proposed some sales tax cuts and a new tax on big tech firms based on the data they gather from Minnesotans. Walz additionally suggested offering financial relief to Minnesotans impacted by the Operation Metro Surge immigration initiative this winter. Paul Marquardt offered details.
Currently, the maximum you can get for one child, and this would now be for kids under 5, the maximum credit right now is $1,050. That would raise it, the proposal, to a $3,000 credit. And for 2 or more children in the young child area, the maximum credit right now is $2,100. That credit now would be $6,000. That is significant.
Walz said Minnesota would have one of the biggest such tax credits in the country. Childcare has been a major factor in workforce development and retention in Minnesota, particularly in healthcare.
That's Abby Machtig. The governor this week also named former Health Commissioner Jan Malcolm as a senior advisor in the governor's office and the health subcabinet. Malcolm served as the commissioner of the Minnesota Department of Health from 1999 to 2003, and then again from 2018 to 2023. Walz said she'd been tasked with looking at hospitals in the state with a particular focus on HCMC. The hospital has already cut about 100 full-time jobs and made reductions to 5 medical programs and closed about 100 beds to patients. Hennepin Healthcare was back at the Capitol this week, telling the House Tax Committee that without a sales tax dedicated to the hospital system, HCMC was in danger of further cuts, if not outright closure. And the state's Department of Employment and Economic Development said 34,000 Minnesotans have now been approved for paid leave under the new Medical and Family Leave Program. The state-run system started in January. State officials said the program is under budget so far. Also this week, some interesting new data on health insurance in the U.S. The Wall Street Journal said that a third of people enrolled in Affordable Care Act plans across the country last year have left the marketplace, and nearly 10% are believed to be without health insurance at all. A survey by KFF found many cited steeply rising costs. That same poll found more than half of ACA enrollees felt that President Donald Trump and congressional Republicans were responsible for the cost increase. About a third blamed Democrats. Also, a new poll out by Axios and Ipsos this week found that 7 in 10 Americans want the government to address rising healthcare costs with federal tax dollars if necessary. That includes nearly 6 in 10 self-identified Republicans. And nearly 1 in 5 Americans report that either they, a friend, or family member is taking a GLP-1 weight loss drug, and more than 1 in 10 say they've taken GLP-1s themselves. That's it this week from Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson. Thanks for listening.